Ladies and gentlemen, welcome to Medicas Video Podcast. My name is Varun. I hope you're all doing well. We have already come into the summer season. I hope you're all taking a good care of yourself, not going into the sun in the morning times and in the afternoon times. Keep hydrating yourself and ensure that you don't fall for this heat that we have been experiencing in the recent times. So we are back again with yet another important topic to discuss. We have Dr. Sandeep Nayak with us. Dr. Sandeep Nayak has been in the cancer treatment as a laparoscopic as well as robotic surgeon for a very long time. He is not only a robotic and laparoscopic cancer surgeon, but he is also an inventor, scientist, micro angel investor, startup mentor, artist, author, and speaker. So Dr. Sandeep Nayak has been working with Fortis Hospital as a senior director surgical oncology, robotic and laparoscopic oncosurgery. And he also owns a clinic in Bangalore with the name MACS Max Clinic. He's the founder as well as a consultant robotic and laparoscopic oncosurgeon. Namaste, Dr. Sandeep, sir. Welcome to our video podcast today.
Namaste and thanks for having me.
Absolutely. The pleasure is all ours, sir. Sir, we understand your skill as well as your subject matter expertise around the laparoscopic surgery. And this term laparoscopy has been in the medical world, especially around the patients in the past 10 to 15 years, Dr. Nayak. So, Dr. Nayak, can you help us understand what is this laparoscopic surgery? Is there a relation between this laparoscopic surgery with robotic surgery, Dr. Nayak?
So, see, laparoscopic surgery actually started more than 100 years back. It's not new.
Oh, oh,
Okay.
okay.
So, it's been like in the beginning of last century, some gynecologists started looking into patients with pelvic pain, means in the lower abdominal pain. They started putting a small tube to look into their pelvis to see why there is pain. So that's how laparoscopy started. And I think it was in 1985 or so, first gallbladder removal was done laparoscopically. Okay, so from then on,
Oh,
the technology started improving. So the camera quality, the energy sources, the kind of
right.
safety mechanisms, thing started improving, and that is how laparoscopy emerged as a major tool in the surgical armamentarium. Now,
Okay.
what also happened was, as it was emerging, a lot of complex surgeries were also beginning to be performed by it, like cancer
Okay.
surgeries, the very big surgeries. And there were a lot of controversies as it went on, because people thought, oh, the clearance is not as good, the quality of surgery would not be as good as open surgery, and things started the evidence also was dilly dallying. And over time what happened was, lot of research came into it, like there are many trials, clinical trials what we call, where they compare between open and laparoscopic surgery, and
Okay.
eventually the proof emerged that it is equal, and some scenarios superior to open surgery.
Oh, okay, okay.
So
Now,
that
what
is how.
what
Yeah,
happens, sir? Because we know as laymen, sorry to interrupt you, Dr. Naik,
yeah,
for our audience sake, we know from in surgeries have been happening for a very long
yeah.
time, and the most common surgery which every individual can understand is a cesarean surgery, where they cut
Hmm.
open the womb and they take the baby out, right? So, what our audience would like to understand is how is this conducted? Are you still going to cut? Or what is this laparoscopic surgery? How is this performed, Dr. Nayak?
Okay, so the minimal access surgery includes what is called as laparoscopic as well as robotic surgery. So, what is the difference between open and laparoscopic? In open surgery, you're putting a large wound to see up. You're basically opening whichever part of the body, you're putting a big wound, opening the entire area, and seeing inside the abdomen or chest or wherever you are doing it. In laparoscopy, you put very small wounds, like 1 centimeter, 1.5 centimeter, to put a camera into that cavity and see there and then operate or do whatever it
Okay.
is. So,
Okay. So
so,
then,
so basically,
mhm.
yeah, you can say, like, some in some scenarios, a 30 to 40 centimeter wound can be avoided by just 1 centimeter wound to put one camera inside.
Absolutely, doctor. And I
So,
believe the
yeah.
recovery time also will be very quick, right, doctor? If I'm not wrong, the recovery time, the wound, the incision is less.
Yeah. So So eventual advantage of that, see, when the laparoscopic surgery started, the idea was that it was cosmetic, because it looked better, because there's no scar. So that's what was propagated initially, that there's no scar. So eventually what happened was, we realized the recovery time is shorter, pain is less. There is of course no scar, but added to scar in long term, there can be the, see, whichever wound which you make can develop hernias. So there
Correct.
is a risk of hernia development. Hernia means weakness over there. So that is
Right.
also not there. Bigger the wound, higher the risk of weakness.
Yes. Correct, sir.
So
Correct, sir.
all those things, we realize that it is much less. The requirement of pain medication is less. The hospital stay is less than 50% for most of the laparoscopic
Oh,
cases. So there was a huge difference which was perceived between the laparoscopic and open surgery. So it became a standard of care for most of the general surgical work. Today, you
right.
won't hear
Right.
many people talking about the gallbladder removal done open by open surgery.
Okay.
Hardly
Okay.
anybody does it. And
Right.
most of the
Right. Right.
appendix surgery is also done laparoscopically. So there
Right.
has been
Right.
a shift in thought process itself. Nobody
Exactly,
wants to
doctor.
put a wound. It's not about cosmetic reasons. It is about recovery. It's all about
Absolutely.
recovery.
Right, sir. Right. We understand what you're explaining, doctor. Doctor, there is one
I'll
more.
take it one further. I'll take it one
Sure.
step further.
Sure.
So now, over time, what happened was the quality of cameras improved. Today, everywhere, whatever we use,
Yes.
the camera is very high quality. I am using a
Yes.
4K camera sitting over here on my desktop,
Yes,
right?
sir.
So same way in surgical thing, equipments also, camera quality changed. So as of today, the vision that is provided by a laparoscopy is far better than a open vision, because
Oh,
camera can go in nook and corners. You put a camera inside a big cavity, you can pass it anywhere, and your monitor shows you high definition
crystal
4K
clear.
image.
Exactly, sir. Exactly,
And
sir.
my
I agree.
camera, see, if an organ is sitting somewhere, I can go extremely close to it.
Right, sir.
Right? My eyes cannot go do that in open
Correct,
surgery.
sir.
When
Correct,
I'm
sir. Right.
opening and I'm seeing, I cannot, my eyes cannot go. So that's
Right,
the
sir.
difference
We
which is
understand.
significant.
Absolutely. We now understand very clearly the difference between laparoscopic surgery as well as an open wound surgery, and the advantages of laparoscopic surgery versus the open wound surgery also. Dr. Naik, being a cancer robotic surgeon and laparoscopic surgeon, what are the most common cancer treatments that are well suited for this laparoscopic technique, said Dr. Naik?
See, when it comes to laparoscopy, it is all about the skill of the surgeon.
Okay.
Okay, so it is, see, it is about, can you do the same work which you do by open surgery? Can you do it laparoscopically or not? That is a question. So if
Right.
the surgeon can do it, then it can be done. Now, which are the
Okay.
places where there is no cavity to really do? Uh, any bone cancers we cannot do, any muscle cancers we cannot do. But apart from these, most of the other places, it is possible for us to do laparoscopically as of today. Like,
Right.
we
So,
can do in the neck, we can do it in the upper part of the thigh, some surgeries we can do. And so, abdomen and thorax, anything and everything, means in a chest and the abdomen, anything and everything can be done laparoscopically as of today, subject to the skill of the surgeon.
right, right, Dr. Naik. Dr. Naik, this question is especially for the patients that are suffering with the cancer. Now, who decides whether that patient has to go through an open wound surgery or a laparoscopic surgery? This is for those. This question is coming from those patients that are already in the hospital, maybe deciding whether they should go for a surgery or a chemo, or discussing the options of surgeons and surgeries, etc. Who decides that? Who will make that call?
Surgeon.
Okay, okay,
I'll
okay.
answer that. I'll qualify that answer also further.
So,
The reason is, see, it is a very, very, skill is a very subjective thing,
right.
right? So, a surgeon who knows how to perform and deliver that same quality of surgery, whether open or laparoscopically, is the one who can give you both. But a surgeon who cannot do it laparoscopically and can only do open will have to offer you open only, because the
Open.
quality matters. At the end of the
Exactly,
day,
sir.
in cancer, the quality of surgery really matters, or anything. because
Yes, sir.
surgical outcomes are quality dependent,
Yes, sir. Yes, sir.
right?
I
So
agree with
quality
you.
of surgery matters. So if you cannot do an inferior quality surgery just to do a laparoscopic surgery.
Right, right.
It
So,
has
do you
to be,
suggest?
yeah,
Yeah, sorry,
it
sir.
has
Please,
to
I'll
be
let
of
you.
quality. So the surgeon decides. Now, what
Right,
can the patient do? Patient can choose between a surgeon who can offer them X type of surgery, or we call it approach. X
right.
approach means open approach versus laparoscopic approach. So,
Yes, sir.
patient can choose between the doctor who offers X approach and the Y approach, whichever it
Right,
is.
right, Dr. Naik. So, Dr.
Okay.
Naik, are you going to suggest to our audience who are in the dilly-dally state of mind whether they should go for an open wound surgery or a laparoscopic surgery to consult with you, to show you the reports and everything else, and take your opinion also whether it can be done, or probably you can do that laparoscopic surgery or not? Do you recommend? Do you want to suggest those kinds of patients when they want to personally consult you, Dr. Naik?
No, I wouldn't really see. I will not say anybody to come to me because that is not
Okay.
correct ethically also. So
Okay.
it is the patient's choice, and there are many
Right.
surgeons who offer good laparoscopic surgery. There are many people
Right.
who do it, high quality
Right.
work. So it is not. It's not that I'm the only one who's doing
Ah, of
it.
course.
Okay,
Absolutely. Absolutely,
so
Dr. Naik.
so it is
I
not that.
understand.
See, it's
Sure.
a message is about the technique and technology rather than anything else.
Right, right.
Okay,
Dr.
okay.
Naik, in your experience of, you must have done hundreds of surgeries using laparoscopic techniques and robotic techniques. What was the most complicated surgery that you have performed, Dr. Naik? Maybe you can walk us through a quick, very high level case study, Dr. Naik. Maybe keeping the patient's details, everything confidential.
See, at my stage in career, I do lot of complicated work. So I can't have one surgery standing out
Well, there could be
anywhere.
one thing that will always, remain in your mind.
Every every month, every day, we do so complicated work that nothing really stands out in a way that I can tell you that this is the most complicated work. So I would put it this way: the next surgery we do is the most complicated work, because
Okay.
once we finish doing the last surgery, we say, "Oh no, this is over. We did it. It is quite comfortable."
We
So the
understand.
next one which we are looking at, oh, this is a challenge, this is a problem. So that one is the most complicated work. The
Right.
last one is past, so that is already done. So I don't want
Right,
to.
right, right. I understand. I
I don't
understand
want to do
completely.
this. I don't want
No,
to pat my back
I
and say,
understand. No,
yeah.
no, I mean, it's
So,
like, it's for our understanding's sake, Dr. Naik,
yeah,
we're asking, and you have been very modest in answering that. Dr. Naik, this is, and again, a very common question, because most of the cancers, when they are detected in the early stages, they can be, cleared out.
yeah,
But there are a lot of scenarios where it gets metastatic, or they get advanced. So,
correct.
does laparoscopic surgery qualify to do a surgery on a metastatic cancer or in an advanced stage of cancer, Dr. Naik?
See, now that question is not actually correct. The question you are asking, because
Okay.
the problem with that question is it is assuming that laparoscopically we can do. Uh, See, the indications of surgery and treatment are different for open and laparoscopic. It is not.
Okay.
So
Okay.
whenever we talk about the treatment of for this particular condition right now. So it could be say say for example rectal cancer surgery. We may say this is the treatment is ISR, or intersphincteric resection for very low rectal cancer. You have this is the treatment, and the approach can be open, laparoscopic, or robotic. So you
Okay.
are not talking about. So because of laparoscopy, I'm going to do something different for you,
Okay.
right? It's
Okay.
only the approach.
Understood.
So
Right.
if metastatic or stage 4 cancer can be treated, then the approach comes as to whether open, laparoscopic, or robotic
Right.
can be chosen.
Yeah.
So same way, like I usually give an example. See, it is like your first decision to take is, say you're traveling from Bangalore to Delhi. The first decision is you have to decide about your destination.
Correct. After that, the journey,
Then you take about the
yeah,
approach.
how do you want to commute?
Yeah,
Exactly.
yeah.
Exactly. I agree with
So
you,
the
doctor.
same way in surgery also it's the same, or treatment also it's the same thing. What is
Okay.
the treatment which is required, and what is the approach you are going to take? So the
Procedure
two
that
are
we need to
different.
follow for
Yeah,
that.
yeah. Yeah,
Got it,
there
doctor.
is definitely another point over there. I cannot give you an option of going from Bangalore to Delhi in a boat.
Right. Absolutely.
So,
We
so
understand
there will
that
be
point also,
sometimes,
doctor.
I'll say, okay, for this surgery, this is not possible.
Right, doctor.
Okay,
Great. So, Doctor
so that is how it.
Naik, absolutely. Dr. Naik, the last question that we want to understand related to laparoscopic surgery for cancer treatment is what kind of advancements are you anticipating that we can expect, especially for surgeons performing laparoscopic cancer surgery in the near future, Doctor?
See, things in this world are evolving rapidly. Today, you know, AI/ML is coming in a big way,
Yes, sir.
and robotics is coming in a big way.
Yes.
Now, as we go on, I my perception and what I see happening is these two things will come into surgery in a big way. So every laparoscopic surgery will eventually have some bit of robotics into it, some bit of AI involved in that. So that is the evolution which is going to happen. So this is how it is going to happen over in the next few years. Eventually, robo is basically, and robotic surgery is basically an advancement over laparoscopic surgery. It is not something which is separate from laparoscopy. As far as our surgical, what we call as a soft tissue surgery, surgical robo is concerned.
Right.
There's bone surgery robo also, that is different. But soft tissue surgical robo, it is the what you call um, uh, the advancement over laparoscopic surgery. So that is the thing. So that is what is going to happen over the next few years.
Absolutely. Thank you so much, Dr. Naik, for sharing a lot of important and logically understandable information related to laparoscopic surgery. I hope our audience have also understood. So, Dr. Naik can be found on our website, www.medicasapp.com. You can download our app, Medicas app from Play Store as well as on App Store. His clinic is in Bangalore. So, the clinic's name is again MACS Max Clinic. So, you can find it online. We will also give information regarding his clinic under the description. You can find that and you can consult his clinic, walk in, or you can call in. You can make your appointments, whoever is around the Bangalore area. Once again, Dr. Naik, thank you so much, sir, for sharing your valuable time as well as information with our audience.